Good morning. We've been doing our series on depression. Happy Friday to everybody. The topic today is, should I take Prozac or should I take medication for my depression? That is a very easy question. First of all, you need to be diagnosed with depression. There's a video on what is major depression. Now, there's major depression, there's dysthymia, there's adjustment disorder with depressed mood. There are different types of depression. And there's also premenstrual dysphoric disorder. So men, if your wife or your girlfriend tells you there's a little feeling, irritation from a certain time of month, believe them, because there is a formal diagnosis of PMDD. So when you begin to think about how you treat depression, medications is one way. Psychotherapy, we do something called behavior activated therapy. We'll tell you to go out, do some walking, do some exercise, go to a movie. But now a lot of the conservative approaches you can't do because of the pandemic. So the question gets to be, what level is your depression? So if your depression is something that is really debilitating, you can't sleep, you can't eat, you can't focus, a lot of guilt, then what I would suggest is you'll be evaluated by a physician. You can start with your primary care doctor. Most primary care doctors can treat you with the low doses of Prozac, Zoloft, Lexapro, Abilify, a lot of medications, low dose. However, if that medication does not work and you need more, then that's where you have to kind of bump it up and you see a psychiatrist. And there's a large armamentarium of medications that we could treat. The most popular ones being the SSRIs, which you've heard about, Prozac, Zoloft, Lexapro, wonderful drugs. But we do have some that are more new, decreased side effects. One of the major complaints is sexual side effects with some of our medications, and a lot of you want to have sex, so we have to worry about that. So we do have a lot of medications that can help you. But the reason for medicating in depression is to prevent suicide completion. I want to tell you that depression is very, very real. I don't know if any of you have ever known anyone to complete suicide, but it's a terrible feeling. It's because when depression becomes overwhelming and people can't discover or find the way out, then the only way out is suicide completion. So I want to share that with you. I hope this has been helpful for you. Should you take it or not? If the depression is debilitating, if the medical illness is causing some problems, yes, you should consider psychopharmacology. Have a happy Friday. Thanks for stopping by. See you again.